Yes, I want to welcome you to this session, so inspiring raising initiatives from our global community. In this session, basically, you'll hear from several members of the coalition who are doing amazing work. They will share some of their initiatives, and I hope that this will inspire you. I want to invite them to the stage. So we have Angela, Sarah, Alessandro, and Christine. If you can join me. And just before we begin with the presentation, I would like you to briefly introduce yourself. You have a microphone on your chair. If you could just mention from where you are, who you are, what you do, and then we can start with the first presentation.
So, hello everybody. My name is Sarah Coffey-Desgrange. I am with Cancer Vessi France. So I work with Laurie, and she's doing a fabulous job there. I'm working on the social media part of Cancer Vessi France since 2022, and I'm with the coalition here this is my second year on the board of the coalition. So I'm delighted to be here and feel very privileged also, and I am a patient.
Thank you, Sarah.
Hi, I'm Angela. I'm from Canada. I work with Michelle with Bladder Cancer Canada. I'm also a patient, and I've been volunteering for a few years. This is my third year here, so it's nice to see some familiar faces, and I'm looking forward to getting to know people a little bit further.
Hi everyone, I'm Christine LaRose. I'm from BEAT Bladder Cancer Australia, and I'm the patient and support lead for the charity. I've been involved with BEAT since it was formed in 2018. I'm also a bladder cancer survivor, and this is my second time attending this conference.
Thank you.
Okay. Hello, good morning. I am Alessandro Boni. I am from Italy. I am a patient. I am a volunteer in Italian Association Palinuro, and this is my first year in the board. Welcome to all.
Thank you so much. Then, Angela, the floor is yours. You're the first presentation. Okay. Yes, you can decide so either to do it here, either if you want to do it as you prefer, what makes you more comfortable.
I'll do it here, if that's okay.
Yes, of course.
I'm grateful to be here today. I'm just here to share an important initiative from Bladder Cancer Canada. This is one of our brochures called Hematuria. I do have some here if anyone would like to see. The brochure focuses on hematuria, or blood in the urine, which is the most common symptom of bladder cancer. But it does more than explain what hematuria is. It breaks it down in clear, simple language, the difference between microscopic hematuria, which you can't see, and gross hematuria, when the blood is clearly visible. It describes the risk factors for bladder cancer, when it's appropriate to refer to a urologist, and other possible causes of blood in the urine. But beyond the medical details, the real value of this brochure is that it gives people the confidence to act. If you see blood in your urine, even just once, never brush it off. Bladder cancer, when caught early, is often treatable and manageable. The danger comes when people ignore this symptom. Unfortunately, this happens far too often. Blood in the urine is often assumed to be a urinary tract infection or simply a normal part of aging. In women, it can sometimes be mistaken for menstrual bleeding, either by the patient or even sometimes by her doctor. But those delays in getting checked can have serious consequences, leading to later diagnosis and poorer outcomes. I know this personally. For me, it was seeing blood in my urine that made me stop and go to the doctor. I could have ignored it, told myself it was nothing, or hoped it would just go away. But I didn't, and that decision may have saved my life. That's why I feel so strongly about this resource. It's not just words on a page, it's a tool that can prompt someone else to get checked before it's too late. This brochure puts the message front and center: never ignore blood in your urine. It encourages people to take the symptoms seriously and helps them walk into their doctor's office armed with the right questions. And it's not just for patients. Physicians can benefit from it too. We know that too often, blood in the urine is quickly attributed to a urinary tract infection, as I mentioned earlier. A simple reminder like this, sitting in a clinic or on a desk, can prompt a physician to pause and think, maybe this isn't just a UTI. Maybe this needs further investigation. That moment of extra consideration could make the difference between an early diagnosis and a missed opportunity. So why is it important to have this brochure in our communities and healthcare spaces? Because information is most powerful when it reaches people at the right moment. This past May, we sent 2,000 brochures to urology clinics across Canada. That kind of direct distribution ensures the message is getting into the right hands, patients and physicians alike, where critical decisions are made. Placing these in clinics, hospitals, and other medical settings can make a huge difference. It reaches patients when they're already focused on their health. It empowers them not to minimize their symptoms. It encourages early testing and diagnosis. And it can even reinforce to physicians the importance of taking hematuria seriously. Someone might pick it up in waiting room and recognize their own symptoms. A family doctor might use it as a quick reference when deciding if a referral to a urologist is needed. A caregiver might read it and encourage a loved one to take that next step. Each of these moments could be life-changing. For me, seeing blood and choosing not to ignore it changed the course of my life. This initiative exists to ensure others have that same chance to make that crucial choice to act rather than wait and see. Like I said, I have a few extra brochures with me today. If anyone would like to take a copy back with them, they might be useful as a model if you're considering creating a similar resource. And of course, we also have digital versions available online. I'd be happy to show you how to access them or adapt them for your own communities. And a little shout out, it was staff from Australia that started the hematuria brochure. We adapted it from her for our country. So it's just a little way that you can take something that someone's already done and help bring that back to your own community and make it suit yourself. Thank you.
Thank you, Angela. And if you have any questions for her after the presentation, feel free to ask. Sarah, you will be next. Can I ask the IT team to put the slides on the...
Perfect. Yes, please. Thank you. Good morning, everybody. So this morning, I'm going to talk to you about basically the relationship that Cancer France has with the French Urology Association. So to start off with this and just show you the synergies and how we're working together to make something of it and bring a larger, a stronger message out and hit as many people as possible. So to start off with this, just a quick overview of what Cancer France is. It's a patient and carer organization. It was co-founded by 2 patients in 2017, so it's quite recent. We have 120, we'll say, paid-up members, but that really doesn't give you a good appreciation of the amount of members that we actually have. So the most telling, I guess, numbers here, we've got 1,500 followers on our public Facebook page, and that is a large, very kind of cross-section of the population. On the other hand, we've got a private closed Facebook page, which is only for patients and carers. So people are free to talk about their own experiences, get information from others, etc. So that it's quite a strong thing that we have in the association as a selling point, if you want to call it. The objectives, raising awareness about the disease, helping and informing patients, and supporting research. On the AFU side, so you will see here immediately that it wasn't founded in 2017, but in 1896. So much longer, much bigger, much everythinger association. 1,318 members, according to the 2022 numbers. So our mission together is really teaming up and trying to educate and communicate the message that we have as a patient organization. So on that, I've got 4 examples of our collaboration. The main salient one that comes out is really the Bladder Cancer Awareness Month in May. I've given 2 quick overviews of 2024 and 2025, what we've done. You'll see photos on the right-hand side here. But what I wanted to sort of highlight, I guess, is that we start in 2024 with a press conference where the name of our association came out really, I guess, in the press, and we were very lucky to take part in that press conference. So social media, everything was conquered on that. We're reaching patients and carers all over France because they were able to either be there physically or they could hook up online to the event. Technical jargon was made very simple for the commoner, we'll say. I know in my own cancer journey that my first initial discussions with the urologist, nothing made any sense. It just was far too technical. So this really made it a lot more meaningful. Presentation of the medical developments and an opportunity to meet urologists from all over France, urologists, oncologists, and other patients and carers. The 2025 patient awareness initiative we had with the AFU was a different format. So we had a series of roughly 9 video clips where the patients sat with the doctors, the patients asked questions, and the doctors responded. So with that, we were able to take on a variety of questions, treatment types, quality of life, what happens when the treatment doesn't work, etc. So we were able to take those clips and use them on social media, and they come back and back and back, and we'll be able to use them for many years to come. So that was really, really very helpful there. Every year in November, for the last, I think this is probably our 3rd year, Laurie, the AFU have an annual conference, and part of that is a patient day for urology associations. Here I have put 5 bullet points down, and at the beginning in bold I've put everything as golden opportunity because I really do think that it's a golden opportunity on many fronts. We're able to present the work of CVF, so Cancer Vessie France, 2 other urological patient associations. We network and meet other patients with different types of ailments. We're inspired also by other patient associations. We always think that we're quite inspiring, but we get very inspired by other people also. We network with urologists from other parts of France who also talk to us about different parts of the disease. So, you know, what's the importance of physical activity as you're going through the whole process? So this is all very, very informative for us as patients and for the association, and then a golden opportunity to meet with the industry also. Another part where we've collaborated really nicely with the AFU has been a study that they have launched to evaluate the efficacy of new biomarker urine tests in order to monitor and better control the NMIBC by eventually replacing cystoscopies in view of obtaining future regulatory approval, and they needed 2,000 patients to partake in the study. So we had a key role, I think, a central role in this to help them find those 2,000 patients who talked to the doctors and said, I want to take part in this. So we did an awful lot of communication online. A webinar was set up on this. So we go hand in hand with the AFU. So they're winning, and we're also winning, I think, also because in the end, it's helping us. It's less painful. And finally, the final point I have is revising patient-facing information leaflets. So the AFU on their website have got a number of information leaflets for our patients, and 3 of our 2 patients and a carer helped the AFU this year to update these patient-facing information leaflets, and the CVF was also cited for our participation in the collaboration here. So on that note, take all of that information, use it in your associations, feel inspired. There you go.
Thank you so much, Sarah, for such an inspiring speech. I loved it. Thank you. We have Christine, who's next.
Hi, everyone. I'm going to tell you a little bit about the nurse education initiative that we have implemented across Australia. So we have 2 nurse education programs available. The first one is an online education, modular education package that's available to be accessed via our website. And then the second one are bespoke bladder cancer in-service education sessions. So I'm going to start by talking a little bit about the online education that we have. You know, from speaking to nurses, we found that there was a need to have access to current and easy access to current bladder cancer specific information. And we also realised that the information that was available for our patient and carer community on our website was also a valuable resource for nurses. So we started by holding a round table with key nurses from around Australia, both primary healthcare nurses and urology oncology nurses, to discuss the content and the format of the education. And then we developed that education in collaboration with those nurses to meet their specific needs and requirements. So the access to the education, it's online. There's no passwords or anything. It's easy to access. There's a dedicated tab on our website for nurse education. And most importantly, it's free. There are 2 education pathways, one for a primary healthcare nurse and one for a urology oncology nurse. And each pathway, if you were to do the whole lot all at once, would take about 3 to 4 hours to complete. And the modules guide the nurses through symptoms, diagnosis, treatment, and then the support services that are available for their patients. The primary healthcare pathway focuses a little bit more about symptoms and diagnosis, and the urology oncology pathway goes into more detail about the treatment of bladder cancer. The course is CPD hours eligible. If you complete all the modules, you get a certificate at the end, and it's also fully endorsed by all of the major nursing organisations in Australia. And this online education is for all nurses, whether they're just early career nurses just starting out, whether they're primary healthcare nurses. It's important for them to as they're often the first point of contact for a patient, it's important for them to understand the key symptoms, what to be looking out for, and definitely what questions to be asking their patients. And then also for our urology and oncology nurses, so that they can understand the latest treatment options that are available for patients. And then our second program is our bespoke in-service education sessions. And these are practical, interactive 45 to 60-minute sessions that are available to nursing teams around Australia. They're delivered via Zoom or Teams, whatever the nurse organisation would like. And that allows us to reach nurses everywhere around Australia. So not just the main cities, but we can reach nurses that work in more regional and rural areas. So I present these sessions along with a urologist, and that way the nurses get both a clinical and a patient perspective. And we cover a little bit about a patient's journey. We talk about the statistics around bladder cancer, the risk factors, the symptoms. Then we go into detail about diagnosing bladder cancer and treatment options. And then we also highlight to nurses the information and resources that BEAT has available on the website that they can point their patients towards. We run these sessions at a time that's convenient for the nurses. They often have time available for team meetings, or they have allocated education time, and so we work on their timetable and run the session whenever they want the sessions to be done. How do we advertise these sessions? Well, we do it in a variety of ways. We promote them on social media. We attend conferences around the country, nurse conferences around the country, either as guest speakers or with a booth. We have a brochure for our nurse education that we hand out to the nurses at conferences. We follow up with additional brochures sent directly to their workplace. And then we also send out a regular e-newsletter that has a link for the nurses to go to our website to register or to start the online education. And, you know, through both of these initiatives, we've found that the nurses have access, you know, to current information, and by, you know, giving them additional skills and bladder cancer support, that ultimately benefits the bladder cancer patient community. And if anyone wants to have a look at the education, you go to our website, you can see that directly there by scanning that QR code.
Thank you so much, Christine. Thank you for sharing more about the nurse education program. For Alessandra, thank you. Alessandra now is going to talk to us about the project in Italy.
Okay. Hi again. Thousands of men and women in Italy see red. Blood in the urine can be a signal of bladder cancer. Fifth common cancer in Italy, fourth in the male population. Over 31,000 cases a year, mainly men over 50 years old, but the percentage of women is increasing. Early detection of this cancer is essential, but are often underestimated by patients and by doctors themselves. In the year 2022, Palinuro launched the campaign Stop at the Red Light, with a video directed by Fabrizio Mari and starring by Mauro Neri, which reminds all citizens of the importance of not underestimating any warning signal, in particular blood in the urine, and to seek medical attention for early diagnosis and timely access to the most appropriate therapeutic strategies for bladder cancer. The subject of this video was that a correctly interpreted signal gives an unexpected turn to a man's day and could perhaps change his path of life. The campaign reached about 2.5 million target users through Palinuro's social media channels and was amplified by media activities at national level with a readership of over 10 million. In the year 2023, the presentation of this video at important national film festivals spread echo the campaign even further and brought its message of prevention even outside the traditional health information channels. The video was awarded as Best Advertisement to raise awareness of health and prevention in two prestigious film festivals at Catania and Turin. In May 2024, on the occasion of the month dedicated to bladder cancer awareness, Stop at the Red Light brought awareness to the heart of Milan, with an event that combines information, solidarity, promotion of lifestyles. Stop at the Red Walk. Walking at free pace against bladder cancer, a no-competitive walk that start from the Policlinico hospitals and finished at the Institute of Tumor in Milan, where there were talks about bladder cancer with urologists and oncologists. In May 2025, this event, Stop at the Red Light, took place in Rome. This time, the focus was on raising awareness for early diagnosis with the direct testimony of those who have been through it and those who treat it. On the first Saturdays of May, our volunteers were present in Largo Goldoni in Rome with the Palinuro gazebo to sensitize, inform, and distribute our information brochures and the invitation to the open days in the Roman hospitals. Largo Goldoni in Rome is in the center of the triangle, and at the apex there are the hospitals where Palinuro is present with its volunteers, so-called Euro Angels, Policlinico Gemelli, Policlinico Tor Vergata, Policlinico Regina Elena. In those hospitals, there were specific events. There were Palinuro exhibitions rolls up. Each of these had a theme. Stop at the red light, why and what you can do. Euro Advisor, our website with descriptions of the main urologic hospitals in Italy. Smoking campaign, because smoking is the main cause of bladder cancer. Euro Angels, about the role of our volunteers in the hospitals. Bladder cancer in a nutshell, a synthetic view of bladder cancer. Palinuro Adventure, our patients never give up, and they after surgery run at marathons, climb mountains, cycle, ski, swim, travel everywhere. In the hospitals, there were important moments between clinicians and patients, with many topics and themes about our pathology treated by doctors. All those who attended the open days received two useful gadgets, Palinuro water bottle and the working lamp Palinuro, a light signal to see and to be seen when you walk, run, or cycle. But for 2026, we are thinking that Fermati al Rosso walk could be taken up on Turin or Florence. Every year, we want to be in the most important urological hubs in Italy, where there are our volunteers, Euro Angels, as Napoli, Bari, Roma, Padova, Genova, Cagliari, Palermo. Thanks.
Thank you very much. So in interest of time, we're going to move to the next session, but please don't hesitate. If you have any questions for them, ask during the break or any moment. And I would like to thank you all. Thank you for sharing these amazing initiatives. It's very inspiring to hear you. So thank you for taking the time.